Have y'all seen this? I might ruffle some feathers with this one. Welcome to She Knows DNA. My name is Miavonna, and I am a board certified genetic counselor. What's crazy to me is that it's 2025, okay? The internet can be used for so many things, but instead some of y'all still choose to believe conspiracy theories, and now you're not vaccinating your children, and now people, especially those that are anti-vaccinators, are dying from conditions that really they just needed the vaccine for. Child, let me get myself together. Y'all not gonna worry me in this video. Let's get into it. According to autismspeaks.org, autism or autism spectrum disorder, otherwise known as ASD, refers to a broad range of conditions categorized by challenges with social skills, repetitive behaviors, speech and nonverbal communication. According to the CDC, autism affects an estimated 1 in 31 children and 1 in 45 adults in the United States today. One of the most important things to remember about autism is that, yes, it is a spectrum, meaning that some people may have autism, but truly you can't tell. And then there's other people that have autism and they are nonverbal whatsoever, so they're not even able to communicate effectively with others around them. On top of that, autism looks completely different in everyone. Okay, I've had the opportunity to teach students that had autism, and baby, when I tell you, they acted nothing alike. Nothing alike. It is really a fascinating condition. But the main question in society is, what causes autism? Well, this is something that I consider multifactorial, meaning that there are some genetic factors and then there are also some environmental factors that all come together to make the perfect mixture in order to cause autism. There are multiple risk factors that can increase a child's risk of being affected with autism. One of them being advanced paternal age. Y'all remember we talked about that? Go look at one of my past videos. On the genetic syndrome side, there are a few genetic conditions that have autism as a symptom. One of those that comes to mind is called Fragile X syndrome. I know in the pediatric setting, if we have a child come in to see us as genetic counselors with symptoms of autism, getting them tested for Fragile X is one of the very first standard of care type of testing that we do for those patients. Fragile X syndrome is caused by a change in a gene called FMR1, which is located on the X chromosome. The change of that gene involves an expanded amount of nucleotide repeats of the DNA. What I mean by that is whenever we think about DNA, you remember we have the A's, the T's, the C's, and the G's. So for Fragile X syndrome, what's happening is there is a repeat of 3 nucleotides. So that's going to be CGG. Having repeats of that CGG is normal. However, things go wrong if that repeat gets too long. So when it comes to those repeat sizes, there are 4 categories. We have normal or unaffected. Stage 2 is an intermediate carrier that we label as the gray zone. Stage 3 is premutation carrier, and stage 4 is full mutation, therefore being actually affected with Fragile X syndrome. So for everyone watching this video, I expect your repeat sizes to be anywhere between 5 and 44. That is considered normal. Those in the gray zone will have 45 to 54 repeat sizes. They're not going to have any symptoms, but whenever we do carrier screening on them, they will pop up as abnormal. Next is 55 through 200. That's going to be premutation. Now the thing is, there are some symptoms that may come about with those that have premutation, but I'll get to that later. And then those with Fragile X syndrome have 200 or more repeat sizes of that CGG in that gene. Features of Fragile X syndrome are going to look a little different between males and females, and that is because males only have 1 X, females have 2. So females have that extra X to back up if the first X isn't working compared to males. So features of Fragile X syndrome in males include, but not limited to, large ears, a long face, flexible joints, low muscle tone, high arched palate inside their mouths. They can have an increased risk of having anxiety, ADHD, poor eye contact, sleeping disorders. They could also have speech or language delay, motor delays, ear infections, their eyes are crossed that we call strabismus, seizures, and last but not least, autism. For those that are actually affected with Fragile X syndrome and are females, they're going to have a lot milder of a presentation, both in physical characteristics and in their abilities to socialize and learn. There is a very small percentage of females that have that expansion that puts them in the Fragile X category, yet they do not have any symptoms. Now, getting back to pre-mutation carriers. So whenever we usually talk about carriers, we also follow that up with stating that they are not affected whatsoever. But Fragile X syndrome decides to be a little different, especially in the premutation carrier status, because there are two things to look out for. One of those is called Fragile X associated tremor ataxia syndrome. We usually see this in males compared to females, but what you will expect around 50 years old is for there to be some memory problems, even some tremors, and it'll get worse with age. A lot of times it is misdiagnosed as Parkinson's disease. Now, what female premutation carriers have to worry about is Fragile X associated primary ovarian insufficiency. So those persons will experience maybe infertility or early menopause around their early 40s. Not everyone that is in the premutation category will have any of these symptoms, but please know it is possible. As far as inheritance patterns, it is on the X chromosome, meaning that it is X-linked. So moms, they have a 50% chance for each child as to whether they will be inherited that mutation or not. And then for the fathers, they will only pass it down to their daughters and not their sons. As I wrap this up, there's just a couple of things. Number one, Fragile X syndrome is just one of the many causes for autism. Number two, vaccines do not cause autism. And number three, if you have ever been blessed enough to have an interaction with a person with autism, then I'm sure you will agree with me when I say they have superpowers. I don't care what y'all say, it's true. It's true. Now to leave you with words of wisdom. In the words of my cousin Mariah that we call Honey, actually, I don't think there's any ones that I'm allowed to say in public. But just know she's always right. I'm gonna let that sit in your spirit for a second. All right, you guys, that is all I have for you today. Thank you so much for continuing to support me and my videos. Please feel free to like, share, subscribe, all the things, and let me know if there are any topics that you would like me to cover. All right, guys, I hope you have a wonderful, blessed week. God bless you all, and I'll see you next time. Bye.
Can I call you Rose?